Recording in progress.
Go to the stage. Thank you very much. Well, good morning, everybody. I know most people in the room, but my name is Kevin Smith, and I have the great privilege of being the President and CEO at University Health Network. It's my real pleasure to welcome Minister Holland and his colleague Alex here with us today. It's a very important announcement for research related to the funding from the Canadian Institute of Health Research. And I'd like to very much welcome and thank the Honourable Mark Holland to University Health Network on his first official visit as minister. I suspect he may have visited here in the past as a citizen. As the minister knows, and you do, we are very proud to be Canada's leading academic hospital, intensive in research, intensive in education, and intensive in care. As a top research hospital, we know today's investment is more important than ever. As I mentioned, last year, about $550 million, just think about that, that's a very large amount of money invested in research here at University Health Network, all in an effort to better unlock our understanding of disease and wellness, to better understand how our system can and should work better, and to better ask the basic questions at the molecular and cellular level, right through to the policy level. And today's announcement, I think, actually really does call out a number of important areas on that one, especially focusing on how our system can be better for patients. We know that research allows us to think differently, to ask questions that matter, and of course, to improve our system for Canadians, a system that is universally accessible and available. Patients are clear. They increasingly want to have, and I'll summarize these in perhaps more complex words than I need to, access, care coordination, and transitions of care that allow them to know how they can remain connected with their care team. Today, we'll hear much more about how that can be realized. By the end of this year, University Health Network will have the privilege of offering a true integrated care experience to more than 4,000 patients. The research that will come from that will inform how we can continue to do that better and how we can spread that to other colleague organizations. At the root, of course, is the most important cause, research and scholarship, for a true evaluation that allows us to say, it is in fact better for patients or it isn't. If it isn't, what else should we do and how should we do it? So I want to welcome the minister and please ask him to come to the stage.
Merci beaucoup. C'est un grand plaisir d'être ici avec vous pour un jour tellement important pour notre système de santé, je pense. Let me say before I begin that acknowledge we're gathered on the traditional territory of the Huron-Wendat, the Hanawasi, and most recently the Mississauga of the Credit River. So we had a great conversation before we came in here, and we're talking about the transformation that's possible within our health system. And right now we have some serious issues. We have issues certainly in workforce. We have issues with patients being able to establish a relationship with a family doctor and have access to family health services. And that has some folks feeling despondent. But the reality is, and we just signed an incredible agreement in British Columbia demonstrating the collaboration of British Columbia and the Government of Canada on health transformation and addressing some of these issues. We're going to be doing it in other provinces across the country as part of the $200 billion in additional funding we're going to be putting into healthcare over the next 10 years. But what's critical about those investments is that they come specifically with indicators, so we can show how those improvements are happening. But as we get out of the phase of dealing with some of these most immediate issues, research is going to be an absolutely critical tool to the transformation that has to occur. We have one of the best health systems in the world, but we have the seeds to be the best health system in the world. Let's say, first of all, that we have the best and leading health research in the world, and UHN is proof of that, known globally for the work that it does. And here within the medical ecosystem of just the GTA, having sick kids, having the University of Toronto creates an ecosystem of health that is unparalleled anywhere else in the world. And as we talked this morning, creates a foundation that is incredibly enviable and that we have to utilize. And that's one of the things that I find so incredibly exciting as I go across the country is that the opportunities that exist within our health system for transformation are absolutely there. And that what it requires is total and complete cooperation. You know, during the pandemic, all those in healthcare, and certainly all the folks I'm looking at here in this room, had to carry a totally disproportionate burden, something that was really, if we're honest, completely unreasonable to ask of a fellow citizen. So first of all, I want to say thank you for your sacrifice and what you carried through those dark days. But you did more than just survive. You did more than just help Canada to have one of the best responses anywhere in the world, have one of the lowest death rates to the challenge of the pandemic. You also lit a way to do things differently. That period of time saw unprecedented cooperation between provinces, hospitals, researchers, and the federal government, municipalities, where we set everything aside, partisanship, ego, turf, and we asked one question: how do we keep people safe? How do we keep people healthy? That has to be the core of what we do, and research is absolutely at the core of what we need to make happen. And so CIHR is such a critical vehicle for the federal government to support the transformation that needs to occur and the work that needs to be done on integrated care to make sure that patients through their whole journey of health have the support, because we know that's where we get lost. It's one of the things we're talking about as the patient is moving and transitioning. That lack of integrated care is a real problem. That's why I'm excited to be here today, because we're talking about solutions. Today, I'm very pleased to be announcing $26.6 million that will support 13 research teams across Canada and a knowledge mobilization hub through a new research initiative called the Transforming Health with Integrated Care. This is going to build our capacity for research, create new knowledge, and help coordinate learning around people's distinct population-specific needs. And I know that folks are going to be talking about some of the work that's there, but it's critical when we're looking at supporting patients through their whole journey and having the best quality integrated care. This research is going to provide the proof, the evidence, the data to help make those policy transformations. And so this $26 million, more than $26 million, is going to be absolutely critical. I have a real pleasure to meet some of the folks that are going to be involved on the ground and leading this research. And I hope to be back to UHN as we have more great things to talk about. But today, let's talk about the transformation and the good this program is going to do. Thank you so much.
Well, thank you, Minister Holland, and it really is terrific to hear about this new announcement for support for research, and particularly at the stage of supporting the integrated care, the generation of evidence, and not only the ability for us to design better healthcare models for patients, for providers, for the systems, for the efficiency, but also to ensure that the work that is going to get done has the best chance for opportunity for an efficient adoption back into the healthcare system. So thank you once again. So it's now my pleasure to introduce Dr. Rick Glazier, who's the Scientific Director of CIHR's Institute of Health Services, and also the Policy Research and a Senior Core Scientist at the Institute for Clinical Evaluative Sciences, ICS. To the podium to deliver remarks. Dr. Glazier is a staff family physician at St. Mike's here in Toronto, another great academic hospital here in our environment. He's also a professor at the University of Toronto in the Department of Family and Community Medicine, at the Faculty of Medicine, and also at the Della Lana School of Public Health. And he's here today to address the importance of investing in evidence-informed integrated care transformation.
Very much, and thanks to all for this wonderful opportunity today. Thank you, Minister Holland, for your remarks and for joining us today. Welcome, everyone. Today, alongside Minister Holland and our partners, we're thrilled to announce the results of the Transforming Health with Integrated Care initiative, something we like to call THINK with a C. So this is a research initiative, and also to introduce today the implementation science teams and the Knowledge Mobilization and Impact Hub. For this announcement, we're fortunate to have members of the 13 teams and the hub, as well as program funders, joining us both here in person in this room in Toronto and virtually from across Canada. We're also joined virtually by Dr. Tammy Clifford, Acting President of CIHR, And on behalf of CIHR program partners, welcome, congratulations, and thank you everyone. De nombreux Canadiens, en particulier ceux qui ont des problèmes de santé complexes ou sont membres de groupes longtemps marginalisés, peinent à obtenir des soins et à s'y retrouver dans notre système de santé fragmenté. Les soins intégrés, un modèle de prestation qui coordonne les soins et services en fonction des besoins des gens, sont devenus une priorité absolue. L'initiative Repenser la santé par des soins intégrés, RSSI, vise à produire des données probantes pour orienter la mise en œuvre et la généralisation des modèles de soins intégrés partout au Canada. We recognize that in most cases, the solutions in healthcare are actually well known, but how to put these promising innovations into practice is not. As Andre Picard highlighted, we're not facing a healthcare crisis, but rather an implementation crisis. To address the implementation gap and catalyze the advancement of transformative integrated models of care, the Institute of Health Services and Policy Research and our partners co-developed this initiative called Think. The 12 program partners have invested over $26 million to fund 13 implementation science teams and a knowledge mobilization and impact hub. This investment is possible due to partnerships involving CIHR institutes and initiatives, including the HIV/AIDS and STBBI Research Initiative, the Institutes of Aging, Circulatory and Respiratory Health, Human Development, Child and Youth Health, Gender and Health, Genetics, Musculoskeletal Health and Arthritis, and the Strategy for Patient-Oriented Research, as well as provincial and federal partners, including the Fonds de Recherche du Québec Santé, Research New Brunswick, the Saskatchewan Health Research Foundation, the Ontario Ministry of Health, and the Social Sciences and Humanities Research Council. I want in particular to, because she's here today, to thank Jillian Paul, our Ontario Ministry of Health funding partner, who's with us this morning. Led by a dedicated team of researchers, healthcare providers, decision makers, and people with lived experience. This is a group we call our quadripartite leadership model. So all of these folks work with the researchers in the leadership of these teams, as well as the hub. The 13 implementation science teams will tackle a range of complex healthcare challenges and generate actionable evidence to advance integrated care in Canada. Here in Toronto, I'm delighted to congratulate Dr. Karen Okrainec and her team, who are working to improve the quality of care, you'll hear from her shortly, to improve the quality of care experienced by older adults during the transition from hospital to home, and Dr. Walter Wodchis and his team, who are spearheading the initiative's hub. This hub will coordinate and facilitate collaboration across all 13 teams and enhance the dissemination and uptake of evidence in policy and practice. In tandem, these programs drive us closer to our collective goal, a dynamic community dedicated to evidence-informed integrated care transformation that advances the quadruple aim goals and health equity. I look forward to hearing Dr. Okrainec and Wodchis discuss the envisioned impacts of their work and its potential contributions to the well-being of Canadians today. I encourage everyone to learn more about all 13 teams, aims, and the hub by visiting the CIHR website. I also want to acknowledge Dr. Andrea Furlan, where are you? Right here, who's also one of the recipients and leaders of one of the 13 teams who's with us this morning as well. In closing, we embark on a transformative journey to contribute to reshaping healthcare in Canada through the Think implementation science teams and knowledge mobilization and impact hub. These initiatives represent the culmination of true pan-Canadian collaborative efforts and a shared vision among partners, researchers, communities, committed to ensuring that evidence is put into practice to improve the care and outcomes for people across Canada. Merci de vous joindre à nous dans cette démarche remarquable.
Thank you, Dr. Glazier, and also thanks to you and to all of the partners that have put this exciting program together, and all of the 13 teams across the country that will be working hard to implement and generate the evidence that that is so needed for this particular area. It's a great pleasure now to introduce our own Dr. Karen Okrainec from UHN. She is a scientist at the Toronto General Hospital Research Institute and a physician in the Department of Internal Medicine and an assistant professor in the Department of Medicine at the University of Toronto. Her research addresses gaps in the healthcare system for patients transitioning in and out of the hospital by improving patient experience and post-discharge outcomes through innovative tools and new models of care. and is leading one of the 13 teams that you've just heard about. Karen.
Good morning, everyone. And thank you, Minister Holland and the Canadian Institute of Health Research for providing me with the opportunity to speak about our integrated care project, a project that I co-lead with my colleague, Dr. Michelle Grinman in Calgary. We are very excited and grateful to be receiving funding support and delivering what many of us ultimately believe is a meaningful solution for many shortfalls within our healthcare system. Both Dr. Grinman and I are general internal medicine physicians and witness firsthand the challenges experienced by our patients and families in navigating our strained and complex healthcare system to obtain the care they need. 20% of Canadian adults are living with multiple chronic diseases, and even more are seniors with frailty, making them among the highest users of the health system with the poorest health outcomes. Unfortunately, our system is failing our most vulnerable, who often find themselves needing to seek medical attention in hospital. This is because communication and coordination of services is siloed, creating a disconnect between hospital and outpatient services. These inefficiencies also create significant barriers and burnout for healthcare providers across the continuum of care. There has been a lot of work in recent years, including great work from Wodchis, who you will hear from shortly, which have shown that integrated healthcare delivery models are the most effective way to address fragmentation of services and barriers to accessing care. The integrated care program at University Health Network is a patient-driven model of care that is addressing these issues head-on. Since 2019, nearly 4,000 patients have been enrolled across several departments in our hospital with the aim of linking high-risk patients with an integrated care lead who creates a care plan tailored to the needs of each patient, including connections with community services, providers, and a plan for follow-up. In collaboration with clinicians, scientists, patient partners, and knowledge users from multiple sectors, our team will evaluate the impact of UHN's integrated care program on adults with multimorbidity and seniors with frailty and complex care needs. Our partnership with Dr. Grinman from Alberta Health Services will allow us to spread and evaluate the program in the Albertan context, leveraging some of the strengths in complex care that exists within the Calgary zone. This collaboration has led to our joint application for the CIHR grant and will enable us to build a roadmap for our integrated care model for this complex population in Canada. Together, we believe that this roadmap will pave the way for developing more robust integrated healthcare delivery in Canada that is patient-centered, unified, and resilient. Thank you.
Thank you, Dr. Okrainec. And it's now my pleasure to introduce Dr. Walter Wodchis. He's a senior scientist and the inaugural research chair in the Implementation and Evaluation Science at the Institute for Better Health at Trillium Health Partners. He's also professor at the Institute of Health Policy Management and Evaluation at the University of Toronto and co-leads the Canadian hub of the International Foundation for Integrated Care. He's going to focus on some of the remarks on leading this new exciting team of teams across the country. His own research program focuses on the development, implementation, and evaluation of scalable solutions that improve the health system, integration, and performance. Walter.
Well, thank you very much, Minister, and also to my colleagues here at UHN. It's a pleasure to be here. It's an honor to be selected as the Knowledge Mobilization Hub for the Transforming Health Through Integrated Care initiative. We are thankful to the Institute for Health Policy Services and Research, Health Canada, Minister Holland, and partner organizations, Ministry of Health is here, for funding this program. I'm speaking on behalf of my co-leads. Dr. Richard Levansuk, Alberta Health Services is our policy lead. Ms. Jodie Goldhar is our knowledge mobilization lead. We also have our patient and caregiver partners, Sharon Anderson and Maureen Smith, our provider lead, Dr. Mathieu Isabelle, and the 18 co-investigators who co-designed this program, incluant nos partenaires en Québec, and with Indigenous and equity leads. We're calling this enterprise the Network for Integrated Care Excellence Canada. Nice. NICE is a platform for sharing and accelerating knowledge and action advancing integrated health and social care from coast to coast to coast. With the funding from CIHR, we will connect the work across the Think research teams and create receptor community, including health and social care providers and key policy decision makers across the country. We'll build communities of practice across Canada that allow policymakers, health system leaders and providers, as well as patients and their families, to meet and to identify the ways in which knowledge can be best interpreted to meet their decision-making needs. We will draw together the common and unique threads across all the Think initiatives, Andrea, Karen, to ensure that we capture and amplify the work, combined work, in ways that augment the magnitude and impacts of the entire Think research program. We're building this network on the existing community that has already gathered around the Canadian Hub for the International Foundation for Integrated Care, or IFIC. IFIC is a global organization, has existed for over 20 years to advance the science and practice of integrated care around the world. With members from over 75 countries, IFIC is an inclusive movement for change that shares a common purpose. In 2018, Jodie Goldhar and I created IFIC Canada to bring together patients, caregivers, providers, researchers, and knowledge users across Canada to share experience and accelerate the implementation of integrated care in Canada. For example, in October 2021, we hosted the first North American Conference on Integrated Care with over 500 attendees. IFIC Canada has continued to build on that with online community events, workshop, and master classes. More than 4,000 individuals are already participating in the activity of IFIC Canada, and we will build on this community. Integrated care initiatives have been implemented to improve health in many patient groups across Canada. However, these programs are created in isolation, rarely rigorously evaluated, shared in a public forum, or replicated in other regions. While at the same time, people in every region of Canada are facing the same kinds of challenges alluded to by Mr. Holland, of difficulties and challenges in accessing the right care, the right time, in the right place. NICE Canada is the platform to raise awareness and spread the 13 implementation science teams and advance integrated care for vulnerable at-risk populations across Canada. We are the megaphone for these programs and will also advance the collective impact by building the audience and connecting with patient, provider, and policymakers across Canada. It's going to be my extreme pleasure and honor to be co-leading this work. Thank you very much.
Thank you once again, Dr. Wodchis, and that concludes our formal part of the presentation this morning. I want to say thanks once again to Minister Holland for being here to make that announcement today, for the investment that the government is making through the CIHR in this exciting new initiative, and look forward to welcoming you back to talk about many of the exciting results that come from this new initiative. I'll turn it over to Shelby Chevrier from the CIHR if there's any further questions, and if following that, we'll ask all of the people who are involved with the program for a group photo with the minister. Thank you.
Thank you, Brad. Thanks everyone for being here today. Thank you, Minister Holland, Kevin, for hosting us. We just wanted to open up the floor to questions from the media. There's no media in the room right now. Any media who are on the Zoom call will submit questions to CIHR Media Relations. If there's any questions in the room from participants here today, we have some time to take questions for our researchers or for our minister. If anyone has any, just feel free to raise your hand. All right, I think we're good to conclude today's announcement. Thank you. We'll have all the speakers come back up on stage. We'll take a group shot and then we'll proceed with the lab tour. Awesome, thanks.